If you or someone you love were put in the unfortunate position of having a terminal illness, would you rather have the option to end your suffering that will have no end, or would you rather be in constant, almost unbearable pain until it eventually killed you? My name is Trinity Liner, and today I will be talking about why I believe physician-assisted suicide, also known as euthanasia, should be legal for people who suffer from terminal illnesses. Personally, I've been somewhat close to someone who has a terminal illness. I've seen my parents watch some of their friends who have terminal illnesses suffer horribly until they eventually die. They spend months in constant pain, just hoping that it will end. My mom has told me that her friends who had these terminal illnesses had told her that if they had the choice, they would rather just pass away rather than having to endure the constant pain of their illness until it eventually killed them. This is why I believe that physician-assisted suicide should be legal. These people should not have to suffer until they die without having any other choices open to them. To start things off, I'll be talking about why terminally ill people should have the right to physician-assisted suicide instead of having to suffer. If someone has the knowledge that they have 6 or less months to live while enduring almost unbearable pain the whole time, a lot of people would rather die on their own terms instead of waiting to be killed by their illness. Many people who have these illnesses start to hate life because they are in constant pain and do not feel like they can do simple tasks such as walk outside. People should not have to spend the remainder of their lifetime hating every day because of their illness that cannot be cured. They start to feel like a prisoner in their own body and are pretty much helpless. Terminal illnesses take over people's bodies and their lives to the point where they feel like they have no control anymore. Although, having the option of physician-assisted suicide can give these terminally ill patients a sense of control over what is going to happen in their life and also help to lessen their feelings of helplessness. As of right now, there are 10 states in the United States that have legalized physician-assisted suicide. These 10 states are California, Colorado, District of Columbia, Hawaii, Montana, Maine, New Jersey, Oregon, Vermont, and Washington. These states have legalized physician-assisted suicide, all have a set of requirements that a patient has to fit in to even be eligible for the procedure. The requirements are that the patient must be 18 years or older, have been diagnosed with a terminal illness that is certain to kill them within 6 or less months, and they must be mentally competent. The people who legalize physician-assisted suicides in these states do not believe that someone who has a severe medical condition which is causing unbearable symptoms should be unnecessarily kept alive against their own will. There are many people who do not agree that physician-assisted suicide should be legalized. Right now, I will go over the stances of the people who reject the idea of euthanasia. One person argued, legalizing euthanasia would allow the killing of people who do not genuinely volunteer to be killed, and any safeguards would be inevitably weakened over time. I found this statement to be untrue. As I stated earlier, there are certain requirements that a patient has to fit in to even be eligible for physician-assisted suicide. Anyone else would not even be considered for this procedure. Also, physician-assisted suicide would never be performed on someone who did not genuinely volunteer and want it. The decision to go through with euthanasia is made by one individual. It is not something that would be suggested by doctors. It is simply one person's voluntary, individual decision. Therefore, no one could be euthanized involuntarily. If there was a killing of someone who did not genuinely volunteer to be euthanized, then it would be considered murder and not physician-assisted suicide. The second argument that has been made against euthanasia is that offering to help someone die goes against the code of healing. I also do not agree with this. In cases where physician-assisted suicide would even be considered, there is no way of healing patients who have these illnesses. Healing means to make someone healthy and better again. In these situations, there is absolutely no way for healing to take place. If the patient is in so much unbearable pain, they have gone out of their way to request for their pain to be taken away by euthanization because there is nothing else that can be done to help them, then in the patient's mind, that would be the best way for the doctors to help them. In conclusion, I understand that some of you may not agree with me on this controversial topic, but I thank you for listening to my reasoning on why I think physician-assisted suicide should be legalized. I hope that I've opened your mind to the idea of legalizing physician-assisted suicide. I encourage you to think about what you would do in a terminally ill person's shoes. I want you to think about what you would do if you had to watch a loved one go through an illness that was killing them and nobody could do anything to end their suffering. If physician-assisted suicide was legal, you or your loved ones could have the comfort of mind that there are options for you. I simply ask you to think about it and try to open your mind to this subject. Thank you.